Dr. Raghuvanshi, good morning. Thank you for joining us. Last time when I spoke to you, those were the early days of
Good morning.
demonetization, and you shared a number with me, which is that 40% of your total transactions were cash in nature. So what's the update now? What you told us initially that you had suffered, but now has the suffering only
Yes.
intensified? I should not be using the word suffering in medical language, but what is the pain for you?
Yeah, I think yes, the pain has continued. However, we see a little bit of uptake and things are becoming better. But having a very large segment of our business, 40%, as you said, in cash, impacts us in a big way. Healthcare, however, not being an optional item for people, sooner or later they would make alternative arrangements. But we have seen an average drop of about 10 to 15% in the outpatient numbers. From our side as a corporate who's responsible for human pain and rather removal of human pain, we have taken a conscious decision and we have made OPD charges free, for example, in most of our hospitals where the communities are primarily rural and lower middle classes, as well as we are taking emergencies. But the numbers in OPD had gone down by about 20% in the initial few days, which is now come down to about 10%. So we do see an improvement happening on that front.
Safely
So
assume that
the impact, I think, would last for another 2 to 3 weeks.
Yeah, please go
Yes.
ahead.
Yeah, so what I was saying is that impact, I think, is likely to last for another 2 to 3 weeks.
Okay. But Dr. Raghuvanshi, do you also sense that patients are now beginning to defer certain non-critical surgeries, or do you think after that gap of 2 odd weeks or 10 days rather, things are back to normalcy when it comes to non-critical surgeries?
Yes, the patients definitely have deferred the non-critical procedures in last few days, and that trend is still continuing. But as I said, the numbers are reduced only by about 10%, and the segments which were already on credit mode or scheme patients, those numbers obviously have not come down. So the 40% patients which were cash paying patients, there we still have a drop which is to the tune of about 10%. And that I think trend will continue at least for another 2 to 3 weeks. But eventually, you see, when it comes to medical treatment, I think it is weatherproof that way, and sooner or later people will find ways and means to be able to pay for that in some other form. That is our belief, and that's what is a trend we are seeing right now.
But as a byproduct though, Dr. Raghuvanshi, do you think that you're going to absorb this financial impact? Because, net, we're talking about 4 weeks of a bit of a slowdown, business-wise, purely for you.
Absolutely, absolutely. I think this has been a very important factor. And as I had said it earlier when we were talking about our results, that this is the third quarter, which is typically the festival quarter. It's a sowing season, so the rural population is busy in sowing, so they sometimes defer the elective procedures. As it is, the third quarter is usually slow, and this would definitely add to that impact. Though at the moment we are not seeing it very dramatic, but definitely this would add to the already traditionally low third quarter.
Okay. Dr. Raghuvanshi, so let's talk about life for the healthcare industry beyond this quarter. This quarter it's very difficult to build a scenario and build a case, because what's going on with the economy is something which we've never seen before. And something which we've never seen before, we cannot create a scenario, we will only have to wait for the data. Now the fact that everything comes through the correct channel, usage of credit card has gone higher. I would assume that the usage of healthcare insurance will also go higher. What kind of reboot will happen to large and respectable players like you? do you think a sizable reboot will happen, or the reboot will happen but the change will happen very gradually and slowly?
I think change will still happen slowly. Depending on the what segment of population you are serving, and it will be geography specific. The urban areas where people have the ability to move to other modes of transaction, I think the change will happen rather rapidly in the urban areas, and where the population is primarily coming from slightly more educated groups. However, rural populations, which still will take some time to adapt to the newer ways of transaction. So I think that will take a little longer. However, I don't see a very significant financial impact. If at all, I see that long term this is going to be a good thing, because a lot of treatment which was individual payer is going to go into a credit card segment or another insurance segment, as you said. That might that might get a flip because of this. And typically the TPA payments have been very predictable. The payment cycle is very predictable now, and that makes it good for an organized player such as ours. I think what will also happen is that because of the way the transactions are going to happen in future, the disorganized sector, the smaller nursing homes, etc., will find it more and more difficult to manage the affairs the way they were managing, and that in effect will be very useful for the organized sector. So the companies which are organized companies, they would definitely get a benefit out of this long term. That is what we believe.
Dr. Raghuvanshi, such a pleasure speaking with you today, and thank you for such a candid insight really on how demonetization is impacting businesses like yours.
Find us on Facebook at facebook.com/etnow, and don't forget to click the like button. You can also follow us on Twitter at etnowlive. To stay updated with all our programming, hit the subscribe button on our YouTube channel by logging on to youtube.com/user/etnow.